I'm Dr. Emma, and as a urologist, my mission is to help men of all ages understand, protect, and optimize their health, especially when it comes to the parts of life that we often hesitate to talk about openly. Today, we are tackling one of those subjects, masturbation after the age of 60. Now, I want to start by firmly stating that self-stimulation is a completely normal, healthy, and beneficial activity. In fact, there is strong medical consensus that regular ejaculation offers critical support for long-term prostate health and contributes significantly to mental well-being and stress reduction. However, as the male anatomy evolves through the aging process, as nerve sensitivity, hormonal balances, and vascular resilience change, the habits you developed in your younger years can actually start to create subtle, silent harms. Continuing those old, unadapted routines is where men make mistakes, not out of malice, but simply out of ignorance of how their bodies have changed. Today, I'm going to reveal 7 of the most common masturbation mistakes I see in my elderly patients, and offer simple, science-backed advice to correct them, ensuring your private life remains a source of pleasure, not a cause for concern. The first mistake, and it is a fundamental one that affects comfort immediately, is mistake number 1, relying on inadequate or irritating lubrication. Or worse, none at all. As men age, the skin on the penis becomes noticeably thinner and less elastic. This is a natural consequence of declining collagen and reduced blood flow to the superficial layers of tissue. For men who were previously able to stimulate themselves with minimal or even no lubricant, attempting to continue this practice after 60 is a recipe for micro-trauma. That friction creates microscopic tears in the delicate tissue, leading to inflammation, which urologists call balanitis, and it causes chronic irritation. Furthermore, many men resort to household products, like hand lotion, or various oils, which contain harsh chemicals, perfumes, or are petroleum-based. These non-sexual lubricants can harbor bacteria, or damage the skin barrier, exacerbating the problem. The silent harm here is chronic, low-grade irritation that you simply learn to tolerate. The fix is simple and non-negotiable. Invest in a high-quality, water-based lubricant, specifically designed for sexual use. Use it generously, treating the area with the gentle care that a maturing body requires, ensuring that you maintain the crucial integrity of the tissues for long-term comfort and function. Moving on, the second harmful habit is one of excessive force, which we call mistake number 2. The persistent, overly tight grip. In their 20s and 30s, many men conditioned themselves to use a very firm, aggressive grip, sometimes believing it was necessary to maintain an erection or achieve a powerful orgasm. But decades of this kind of intense pressure can have serious cumulative consequences on the internal structure of the penis. The erectile cylinders, encased in a tough fibrous sheath called the tunica albuginea, become less resilient with age. Repeated, high-pressure microtraumas can initiate a scarring process, leading to the development of Peyronie's disease. This is where dense scar tissue forms, often resulting in painful erections, curvature, and a permanent loss of length. Beyond the physical damage, that tight grip also leads to the desensitization of penile nerves, meaning you require more and more aggressive stimulation to achieve the same result. It's a diminishing return on effort. The remedy is to deliberately relax your grip. Focus on a wider surface area of contact, perhaps incorporating gentle accessories like soft, silicone sleeves that provide even pressure without the localized intensity of a tight hand. This shift from force to finesse protects the internal structures, preserves nerve sensitivity, and prevents debilitating long-term injuries. Our third point addresses a myth about conservation, which is mistake number 3. Abstaining from ejaculation for long periods, believing you are saving it up for later. This mistake flies directly against decades of urological advice regarding prostate health. The prostate gland's primary function is to store and mix seminal fluid. When ejaculation occurs regularly, the ducts are flushed, reducing the buildup of older fluid and potentially harmful compounds. For men over 50, many large-scale studies have shown an association between frequent ejaculation, often aiming for 20 or more times per month, and a significantly reduced risk of prostate cancer later in life. When men go weeks or even months without ejaculating, that prostatic fluid can become congested or even start to calcify within the ducts. While not acutely dangerous, Chronic congestion can cause low-grade irritation and inflammation within the gland. The silent harm here is the missed opportunity for preventative care. Regular rhythmic emptying is a functional requirement of the aging prostate. If you do not have a partner, or if partnered sex is infrequent, maintaining a self-stimulation routine on a consistent schedule, perhaps every 2 to 4 days, is a crucial, non-pharmacological way to support your long-term prostate health. Think of it as necessary maintenance for the gland. The fourth mistake is often an omission, rather than an action, which is mistake number 4. Neglecting to incorporate pelvic floor exercises, or Kegels, into the experience. Most men mistakenly believe that sexual function is controlled solely by blood flow and hormones, but the true engine of ejaculatory control, orgasmic intensity, and even urinary continence is the pelvic floor muscle group. Specifically, the pubococcygeus muscle. As you age, these muscles weaken, contributing not just to issues like post-void dribbling after urination, but also to sexual challenges, like delayed ejaculation, where it takes an excessively long time to climax, or a dramatic reduction in the force of orgasm. The silent harm here is the progressive loss of neuromuscular control. The solution is to intentionally practice Kegels. During your routine before and during climax, consciously contract and hold those muscles, the same ones you use to stop the flow of urine. Then release. Integrating this practice can strengthen the muscle fibers, restore better ejaculatory control, and significantly enhance the sensory feedback during orgasm. It's a simple, free, and highly effective way to support both your sexual and urinary health simultaneously. Next, we address the mental game, leading to mistake number 5, allowing shame, guilt, or anxiety to contaminate the experience. Despite being a completely healthy and natural behavior, many men carry deep-seated cultural or religious baggage that triggers an internal conflict when they masturbate. They feel an immediate rush of guilt or anxiety. This psychological distress immediately floods the body with cortisol, the primary stress hormone. Cortisol is an enemy of healthy sexual function. It causes blood vessels to constrict, making it harder to achieve and maintain a firm erection. And it chemically dampens the neurochemical pathways responsible for pleasure. The silent harm is turning an act intended for stress relief into a source of stress itself. Furthermore, this anxiety can create a self-fulfilling prophecy, compounding issues like premature or delayed ejaculation, which then further fuel the shame cycle. The masturbation experience should promote relaxation and the release of feel-good hormones like oxytocin and dopamine. If it doesn't, you need to address the psychological undercurrent. This might mean challenging old beliefs, practicing mindfulness during the act, and consciously framing it as a healthy, necessary form of self-care and stress management. Your mind and body must be on the same team to reap the true benefits. Our 6th major consideration focuses on awareness, resulting in mistake number 6, dismissing significant changes in sexual function as just what happens when you get old. While gradual changes are normal, radical or sudden shifts in function are not and must be investigated. Many older men experience things like an ejaculation, the inability to expel semen despite achieving orgasm, or the sudden onset of delayed ejaculation. These are frequently linked to common chronic conditions that increase with age, such as uncontrolled diabetes, which can cause subtle nerve damage, or they are side effects of necessary medications, particularly specific types of antidepressants or medications used to treat enlarged prostate, known as BPH. If you notice a sudden dramatic change in your ability to achieve or control climax, or if you ever experience pain or blood in the semen, the mistake isn't the symptom. It's the choice to silently suffer and not seek professional guidance. These changes are signals from your body. They are treatable, manageable, and sometimes they are the first red flag for a broader treatable medical condition. A simple consultation and review of your current medications and medical history with a urologist can often diagnose the cause and provide a clear path forward for resolution. Finally, we arrive at the most holistic mistake, which is mistake number 7, compartmentalizing sexual health by neglecting core cardiovascular and hydration needs. The health of your penis is a magnificent barometer for the health of your entire body. The ability to achieve and maintain an erection is fundamentally dependent on an exquisite vascular system. Anything that harms your heart and arteries, high cholesterol, Smoking, poor diet, or a sedentary lifestyle will first manifest as compromised blood flow to the penis. Men who ignore their cardiovascular fitness are committing a silent harm to their sexual health, viewing erectile difficulty as a local mechanical issue rather than the systemic circulatory symptom it often is. Furthermore, the very volume and quality of seminal fluid are highly dependent on adequate hydration. Many older men are chronically mildly dehydrated, which directly contributes to reduced semen volume and, consequently, a less intense orgasmic experience. The remedy is simple. Look at your sexual function, not in isolation, but as a direct report card on your overall health. Prioritize heart-healthy exercise, stay consistently well hydrated throughout the day, and use any decline in sexual function as immediate motivation to speak with your primary care physician and your urologist about your overall circulatory health. These foundational lifestyle changes are the most powerful form of long-term sexual support available. In closing, the message here is one of empowerment and adaptation. Masturbation remains a healthy, beneficial part of life after 60, but it requires the same informed attention that you give to your diet, your exercise, and your annual checkups. By correcting these 7 subtle mistakes, by prioritizing lubrication, reducing force, maintaining rhythm, strengthening your pelvic floor, rejecting shame, monitoring changes, and focusing on your heart health, you are actively protecting your well-being, both physically and psychologically. Take control of your health narrative and ensure your private life continues to be a source of satisfaction and vitality for years to come. I'm Dr. Emma. Thank you for tuning in.